Hello. I wanted to let everybody know that I'm very excited to be here today at the second annual Hoosier Extracorporeal Science Conference. My name is Tammy Hutton, and a brief introduction of myself. I am the Assistant Nurse Manager of Neurosurgery at Cleveland Clinic, Florida Weston Hospital. And I am here today to talk to you about developing an effective working relationship with other hospital staff and departments in your OR. So, learning objectives that we have for our presentation today is the number one learning objective is that our attendees will be able to recognize 3 barriers to effective communication and working relationships within the OR with other hospital staff members. And number 2 objective is, a result of the presentation, participants will be able to describe 3 effective communication methods for developing an effective working relationship with other hospital staff members. And number 3 is for the attendees to be able to discuss 3 effective methods management may continually monitor for objectively evaluating the system so that areas of deficiency of conflict may be resolved. So your ability to connect with people is now the best and most effective way and the fastest way to be successful in your OR and in your life. In the OR, your ability to connect with medical professionals outside of your role is very important. And one of the ways that we do that in the OR every day is with our surgical timeout. A strong hierarchy structure of healthcare can be counterproductive to well-functioning and effective teams where all members' views are considered. So think about that when we're doing our surgical timeout. During our surgical timeout, every key member of that OR team has the opportunity, and they should take it, to voice up any safety concerns that they have for that patient prior to the start of the case. And then again, at the conclusion of the case, every team member should voice any concerns that they have for that case. And it should all be well documented. Secondly, another barrier to communication in the OR is your reduced visibility behind the red lines. We all know, when we've been working in the OR for a number of years, especially, that when you're behind the red lines, everybody else is excluded. You don't have open lines. You don't have open lines of communication or open lines of visibility to other people within the hospital or even other people outside of the immediate OR. It's very closed off. So you have to be very intentional about the open lines of communication and finding out how to relate with other key stakeholders in your department and throughout your hospital. Through increasing your visibility within the hospital, you meet people within the organization who can help you with your daily management of the operating room and improve best practices. We'll talk more about that later on in the presentation, about how you can improve your visibility and how you can improve your communication with other key stakeholders in the department. Another barrier, a third barrier to communication in the OR, is not knowing who the key stakeholders are. You have to find out who they are. You have to find out, who the game players are in order to be able to be in the game. By knowing who the key stakeholders are, you will know who can help you and support you in meeting your objectives throughout the day within the operating room and in providing evidence-based best practices. It's all about the human connection. The human connection is what helps, what builds synergy in getting things accomplished within your OR and achieving your goals and objectives and achieving optimal patient outcomes. OR management structures and interrelationships are things that we need to be focused on with improving our communication. and implementation of specific policies and procedures, and how those policies and procedures impact each key stakeholder in the operating room, but also other departments within the department and within the hospital. Key OR management must understand the dynamics of the workflow of the operating room. And when we talk about the workflow of the operating room, we're not just talking about inside the operating room. We're talking about everything that happens before the operating room, before the patient gets to the operating room, and everything that happens after the patient leaves the operating room. Constant assessment of effectiveness and efficiency of processes. OR leadership must constantly assess the effectiveness of the policies and procedures and the workflow and the I apologize. Again, the policies and the procedures and the processes was the word I was searching for. It all begins with connections. Successful collaboration between departments is built in relationships. And I'd like to give a few examples of that. When I was on an assignment in a consulting assignment in Massachusetts, the director of the department, I was brought on to implement a Periot 101 program, and I was also brought on to help prepare the department for joint commission. So when I was brought in, the director of the department sent out an introductory email introducing myself to the department, all the team members in the department, but then also to all of the leadership throughout the hospital. And in that introduction, he gave my background, my experience, and my skill set, and what I came there to accomplish, and what I could potentially help them with, and encourage them to reach out to me if they identified anything that they would like for me to help them with. And in doing so, within a week, I received an email from the educators of the OB department asking me if I would help them, if I'd work with them and collaborate with them to implement a similar training program for their RNs in the OB ORs, and teaching the OB nurses how to scrub C-section cases. I happily obliged to that and enjoyed those that time consulting with them. And in doing so, the manager of their department shortly reached out to me after that and thanked me for helping the educators for the department, and asked me if I would help her prepare her department and her ORs for joint commission. And again, I was happy to step up to that. And we worked together for several weeks in preparing her ORs and her departments for joint commission. And in doing that, a conversation did take place between she and I, where she had expressed to me how much she appreciated me helping her and how my willingness in helping her, but that she had previously reached out to the OR manager and reached out to that OR manager on multiple occasions asking for his help, and did not receive any response back from him. And I just emphasize that to show how, if we are unwilling to communicate, how that ceases any movement forward, and how that creates barriers between synergy and between departments collaborating together. Your visibility matters. You want to make sure that others are aware of who you are and what you do. And that was just emphasized in that just story that I just highlighted for you. And if you are a leader in a department, you want to do the same for people that your team members. You want to give them the opportunity to be introduced to key stakeholders. You want to give them the opportunity to be known for what you want to introduce them, just like the director had introduced me. You want to invite those team members to key meetings. And you as a team member, or as, if you're in a leadership position, but you want to manage up. So go ahead and speak up to people that you report to, or other, even if you don't report to them, but people that are key stakeholders in things that are important to your department or important to your role. Speak up to them about what's going on in that area. How can you be actively involved? Is there meetings that you can attend? Is there ways that you can collaborate to, one, be aware of what's going on in the department, but also, two, help move the department forward or help move your objectives forward? Some of those examples of key meetings that you would want to be invited to would be like the daily safety huddle meeting, or a bed huddle meeting. The quarterly, another one is a quarterly surgical services meeting with OR leaders, surgeons, anesthesiologists. Or if your OR is under a big construction, it's very important for many people from different areas of the OR to be involved with construction, because they see things from their viewpoint, from their roles that other people wouldn't see. So it's very important for your input to be taken into consideration when we're talking about OR construction. Who are the key stakeholders? When you're talking about the OR, some examples are house supervisors. House supervisors hold the key to the flow of the operating room. They hold the key to getting patients beds from PACU and getting the patients into ICU beds. That's very important, because if you don't have a flow of patients out of the PACU up to the floors, then the patients are holding up spots in the PACU, which is not allowing room for patients in the OR to come from the OR to the PACU. And that cannot ever happen, because if you don't have beds in your PACU for your OR patients, then your OR patients are stuck in your OR, and now your OR is held up. You're not having flow of your OR. You can't move future patients into the OR when you haven't the ability to get the current patients out of the OR. So you want to develop those relationships with your house supervisors. You want them to know who you are. You want to know who they are. Go not only develop those personal relationships, go meet them personally, so that it can help with communication and help with working collaboratively together. But if there's any meetings regarding the flow, the patient flow, go to those meetings, be actively involved, be engaged, offer your insight, try to help problem solve in the patient flow. Respiratory therapy, the department heads for respiratory therapy, the team members in respiratory therapy, those are other examples of key stakeholders, because when you're talking about the OR, respiratory therapy is needed for portable vents is just one example, or managing a patient on a vent. Both of those are very important, especially, that can, again, hold up the progression of the OR if you have a patient that needs a portable vent in PACU and you don't have one available. So you want to know who the key stakeholders are for respiratory therapy, so that you can be able to reach out to them when you need to and get help from them. EVS. EVS department heads and the team members of EVS. EVS is crucial to the success of your OR and to the efficiency of your OR and to the safety of your OR. EVS safety, you think of terminal cleaning, Think of the infection prevention, disinfecting ORs after the care of an isolation patient, the care of OR scrubs, accrediting agency preparedness. I have historically always had very good relationships with EVS and facilities, and would set up monthly meetings with them where we would round in the department before the day started and look at each one of the ORs and throughout the department to see hands-on with each, team leader, what the ORs in the departments look like. If there is, from the facility standpoint and from the EVS standpoint, is there anything that needs improvement? And that way we have accountability to each other, because we're right there together, rounding in the department. We have a monthly standing meeting, and that helps those relationships, that synergy. It helps to get things done, and in a timely and efficient manner. And it really helps having that teamwork, because you develop those relationships with each other. Facilities, I just highlighted that in the conversation about EVS. Facilities also helps having those relationships to help make sure you have timely repairs of ORs, or things that need to be repaired in the OR. And again, for regulatory agency preparedness. Knowing who the leaders of your biomed is, and the team members of your biomed, and that helps facilitate timely repairs of OR equipment and PM checks. And also, if there's critical needs for equipment repairs, being able to know who to reach out to with biomed and having good relationships with them helps facilitate timely repairs, and when you need something critically taken care of. Supply chain, having those relationships with supply chain, knowing who your leaders are and your team members of supply chain are, and having those good relationships, that helps facilitate teamwork and collaboration. That helps you with having the OR supplies that you need, or getting in new OR supplies, knowing what's available to you. Pharmacy. Oftentimes we have to work with pharmacy in having the medications that we need in the OR, and of course pre-op and post-operatively, and also what we can safely administer to the patient pharmaceutically. So again, knowing who those key stakeholders are, how to communicate with them, how to best communicate with them, how to communicate with them if there's a problem. Another common time that we have to communicate with pharmacy is over diversion. There's a lot of eyes on diversion now, and having those relationships with the key pharmacy stakeholders in going through all of the analysis on reports to determine if there's any diversion going on, and how to problem solve. If sometimes it's not the nurse or any of the providers that are actually doing diversion, but there might be something wrong with the system that makes it more complex and complicated to get medications that are needed, and those issues need to be addressed with pharmacy. Some other key stakeholders are risk management. I strongly recommend having a great relationship with risk management, and I could give many, many examples of that, of how that's beneficial. Some other persons are the chief medical officer and or chief of surgery, or the chief nursing officer. One of the examples that I like to give about risk management, because risk management really helps you prevent or address safety concerns, but also prevent future safety concerns. They help you go through root cause analyses and they help to protect your patients and the department and your nurses in the hospital. They help you make good decisions. I had an example of, we had a patient, it was a 48-year-old tracheostomy patient who was transported from the OR to the ICU without being connected to a properly working ventilator. And it was not recognized until she was in the elevator and in respiratory distress, and she was not able to get help. When they got her up to ICU, they were able to get her help, but by that time she had desated down to 48%. Well, in a knee-jerk reaction, the OR leadership wanted to send out a blast email that from this point on, every patient coming to the OR or leaving the OR that is on a ventilator must be accompanied by a respiratory therapist. Well, the OR leadership worked through that with risk management before we sent out this blast email. Very grateful that we did, because risk management helped us recognize that we don't work in a silo, and making such a knee-jerk reaction was not in the best decision to make, because it does not just impact our department. That if we were to make such a knee-jerk reaction, one, we don't have the authority to dictate whether or not respiratory therapy attends every patient being transported to and from the OR on a ventilator. That decision has to come from respiratory therapy leadership. But also, respiratory therapy doesn't have the manpower to support that. You know, they have their own responsibilities or their own clinical demands on their department that they can't support always transporting every patient to and from the OR that's on a vent. Or what if the patient is going somewhere else besides the OR? What if they're going for an MRI or a CAT scan? We can't, put that expectation on respiratory therapy. They don't have the manpower to accomplish that. So we were very grateful to risk management for helping us walk through that and come up with a better solution than that knee-jerk reaction that we immediately had to want to send out a blast email stating that all patients on a vent must be accompanied by a respiratory therapist to and from the OR. So in conclusion, it's okay to ask for help in running your OR safely, efficiently, and effectively. Asking for help is not a sign of weakness. And through the human connection with others, you gain synergy to solve your OR issues. I'd like to open up these last the time now to if there's any questions that anybody has for me. Well, again, I wanted to highlight how exciting it has been to be a part of the second annual conference, and I hope to be seeing everyone again next year for the third annual. Wish everyone a wonderful, safe Memorial Day weekend. Oh, I do see questions. I apologize. I see questions in the chat. I so apologize. I was waiting on voices. Okay, so let me ask, communication is key. Thank you so much, Tammy. I want to thank you. Should I end? And now we have 5 minutes. Please feel free to ask Tammy any questions. Relationships are so important. We have been the most effective ways you have found to build relationships with perfusion teams. That's a great question, very relevant to our conference. With perfusion teams, that would be with communication and meeting, you know, having those relationships, involving them with the surgical timeout. That's with the OR team itself, the core OR team. But then also with the leadership, it's meeting with them, you know, at least once a week when they come into the department. How's things going? Are all of your needs being met? Are there any, do you have any concerns? Or do you have any supply issues? How are things going with any new surgeons or any new patient patient care, any new procedures that are being done? Anything new that needs to be, you know, how are things going with staffing? I know that Mohammed talked about that at the beginning of the introduction to the conference, but I know that staffing is at a critical point. There are staffing issues with perfusionists. You know, is the perfusion company able to meet the demands of the caseload, the volume